Hello, I'm Dr. Abdelaziz Jabbar. Can I please have your ID? Thank you very much. I'm going to be performing a bimanual pelvic examination on you today. It'll be a little uncomfortable, but it should be over fairly quickly, and you can have a chaperone of your choosing. Is that okay with you? Thank you very much. So I'd ask you to be exposed from the waist down and make sure to maintain as much modesty of your patient as possible. So I'd like you to bring your ankles as close as comfortably possible and your knees as far away as comfortably possible. So I've already washed my hands and I'm wearing sterile gloves. I'll do the general inspection of the outside vagina, mainly the labia and clitoris. Checking for any obvious abnormalities such as erosions. There are none. So now I'll be lubricating my left index and middle fingers, like so. And you should inform your patient before beginning the procedure. So now I'll begin, and please inform me if you feel any pain. So using my right hand to separate the labia, I'll be inserting my index first. Then if there is no cervical excitation, I'll be inserting my middle finger. So now I'll be palpating all the vaginal walls, checking for any obvious abnormalities or masses. Everything is good. And now I'll slip my fingertips into the cervix. I'll be commenting on its size, its shape, its mobility, and I'll be checking with the patient about its tenderness. So after I'm done with that, I'll be performing a bimanual pelvic examination where I'll be palpating the uterus. I'll be pushing the cervix up, and I'll place my right hand on the lower abdomen to palpate the uterus to check for any masses. There are none. So now I'll be palpating the ovaries. So by pushing the right fornix and placing my right hand on the right iliac fossa, I'd be palpating the right ovary, checking for any masses or tenderness. And now I'll be doing the same on the other side, now by pushing the left fornix and placing my right hand on the left iliac fossa. I'll be palpating the left ovary, checking for any masses or abnormalities. There are none. So now I'll be gently removing my fingers, checking for any blood or discharge. There are none. So now I'll be removing my gloves. And at this time, if it's indicated, I'll be performing a vaginal speculum examination and collecting samples for cytological and bacteriological tests and biopsy, but it isn't needed in our case. So now I should offer my patient a tissue or clean her up, like so. Cover my patient up, ensure that she is comfortable. Thank you for your time, and report my findings.